Sorry. Hi, good evening, all. I welcome all of you for this session where we will discuss on some of the important long essays that have been very frequently asked in exam. And we thought since like most of you might be dissecting or have completed dissecting the lower limb, let's start with some of the important questions in the lower limb. So what we'll do is we'll start with one of the most frequently asked question in the lower limb topic, that is the hip joint, right? You take any university across the country, hip joint is one important long essay from the lower limb section. So usually the question will be framed like this. Describe the articulating surface of the hip joint, then its relations, movements, and the muscles responsible for it, and probably end it with applied anatomy. So most often, like this is a 10 marker question, or in some of the universities, this could be 15 marker, right? What is missing here is type of the joint, right? But invariably, the examiner will expect you to write the type of the joint. So what we have done is we have created a incomplete handout, and we will write the answers in the incomplete handout, and this will be available for you for the revision in the app, right? So let's get started. If this is asked as a long essay, how do we write? So the first thing each of us as evaluators, as examiners will expect us, possibly one line of introduction. Okay. So what we will write here, the hip joint basically connects the lower limb, right? What is hip joint? It is a joint where the lower limb is connected with the pelvic girdle, right? So this is one line of introduction we can write for hip joint. Now, once this is done, we can go with the type. This will be a mandatory section for any joint that will be asked in exam, whether it is asked or not asked, right? After introduction, start with the type. So hip joint is a multi-axial joint, and it is an example for synovial joint. But what is expected from us as students is this is a multi-axial ball and socket type, right? Ball and socket type of synovial joint, right? Whether you write multi-axial, whether you write synovial, secondary. But what you should never miss is this is an example for ball and socket type of joint. Done. Then what are the articulating surfaces? What are the proximal and what are the distal articulating surfaces we need to mention? Now, here, the articulating surfaces includes a ball and a socket. The ball will form the distal articular surface, and this will be formed by head of the femur, right? How about the socket? The acetabulum of the hip bone, right? Acetabulum of the hip bone actually forms the proximal articulating surface, or it forms the socket, right? Done. Introduction, type, articulating surfaces. Now, the next important question was with respect to ligaments. This is where most of the students will falter, right? So how do we represent the answer for ligaments? The first thing is list all the ligaments pertaining to the joint. We are discussing about hip joint. If the question was on shoulder joint or on the anatomy of the knee joint, this is the first thing we need to do. List all the ligaments together and always start the ligament with the joint capsule, right? So always start with joint capsule and then list other ligaments in order. So hip joint has a joint capsule, then it has acetabular labrum, transverse acetabular ligament, ligament of head of the femur, iliofemoral, pubofemoral, and ischiofemoral ligaments. Right? So once we have listed these ligaments, try and explain these ligaments briefly. Because if you just name the ligaments, possibly you will get 1 mark for it, not the full mark. Usually, ligaments will be asked for 3 or 4 marks, right? So how do we explain the ligaments? Start explaining the ligament one by one, right? For example, for joint capsule, what we will write? The joint capsule will cover the entire hip joint, first line, right? Then this is what the examiner will expect in capsule, where exactly it is attached. So you need to write it under 2 headings, proximal and distal. So proximal attachment is to the hip bone. Distal attachment is to the femur, right? So proximal attachment is to the acetabular margin. Even if you write this much, it is enough. You don't have to write 5 to 6 millimeter above the acetabular labrum, not at all necessary. But what is necessary is you must mention that the capsule attaches to the acetabular margin. Second, distally, how is it attached? Distally, we know that it is attached to the femur. But where exactly? Anteriorly, remember it is attached to the intertrochanteric line, and posteriorly, remember it is attached to the intertrochanteric crest. But what all examiners will know is it is attached not exactly to the intertrochanteric crest, but a centimeter medial to it. This is what we have highlighted here. We will just mark it. Okay. So anteriorly, we will write it here. Anteriorly, it is attached to the intertrochanteric line. But posteriorly, remember, it is attached 1 centimeter medial to the intertrochanteric crest. If you can write this diagram for the joint capsule, nothing like it. Now, this should be the first diagram that you will write. Joint capsule. Done. Right. Once we have described the joint capsule, talk about the next important ligament. And what is it? The next important ligament we have is acetabular labrum. Why we should describe it? The acetabulum is made deep by this acetabular labrum. So acetabular labrum is a fibrocartilaginous disc. This is a must, right? So this is a fibrocartilaginous ring that deepens the socket. Then what about its function? As we have highlighted, this actually deepens the socket and helps in holding the femoral head, right? If you write this much about acetabular labrum, it is enough. But you must mention that it is fibrocartilage, it deepens the socket, it holds the femoral head tightly. 3 points. Done. Next, the next ligament we have is transverse acetabular ligament. As we have shown here, all you can do is you draw a simple horseshoe-shaped acetabulum and then connect by the transverse acetabular ligament, right? So this is the transverse acetabular ligament which will join the 2 ends of the acetabulum. Done. So as we have written, this actually connects the 2 ends of acetabular notch, right? Done. Then we move on to the next ligament. The next ligament is ligament of head of the femur. One of the important ligament because this transmits blood vessels, right? So this ligament is also called as the ligamentum teres. Teres means round. So round ligament of the femur, right? Now, where exactly this is attached? Remember, at the base. The base, as we can see, is attached to the transverse acetabular ligament, and the apex gets attached to the fovea of the femur. The head of the femur has a small depression in the center, right? That is what we call as fovea. So apex is attached to the fovea and base is attached to the transverse acetabular ligament, right? Done. Next, the strongest ligament of the hip joint is the iliofemoral ligament, also called as the ligament of Bigelow, right? Now, this iliofemoral ligament you must show in the diagram. So, one diagram for joint capsule, one diagram for the transverse acetabular ligament, and in that only we can show the ligament of head of the femur. So, we'll just mark what are the diagrams that we expect. The diagram for joint capsule, then this diagram for the transverse acetabular ligament as well as the ligament of head of the femur. Then the third ligament or the third diagram we would expect is you to show iliofemoral ligament and pubofemoral ligament, right? Iliofemoral ligament is a very peculiar ligament which appears like the letter Y, which is inverted actually, right? So what should we write? This is one of the strongest ligament present in the body. Of course, the strongest ligament we have is the sacrotuberous ligament present in the back of the pelvis. It is inverted Y-shaped. Then this has a base and an apex. If we see, the base gets attached to, this is, just a minute. Here we have the base and here we have the apex. The apex is attached to the anterior inferior iliac spine. This is the apex. At the base, it splits into two slits, a medial and a lateral band. The medial band is attached to the lower part of the intertrochanteric line. The lateral band is attached to the upper part of intertrochanteric line. So if you remember intertrochanteric line, you can mention these two. Are we clear? Done. So this is regarding the iliofemoral ligament. Within this diagram, you can also show one more important ligament, which is pubofemoral. As the name suggests, pubis to the femur, right? So pubofemoral ligament has an apex and a base, arises from iliopubic eminence, blends with the joint capsule. So at least two lines about each of the ligament we need to mention, right? And invariably, this has to be about the attachments, right? Done. The last ligament is ischiofemoral. As the name suggests, this is present in the back of the hip joint. Ischiofemoral, right? So this arises from ischium, gets attached to the gator trochanter of the femur. If you ask me, is it necessary to write this diagram? Not at all. Three diagrams for joint capsule, for transverse acetabular ligament and the ligament of head of the femur. Third, showing the iliofemoral and the pubofemoral ligament. If you write these three diagrams for the ligaments, more than enough. Don't waste too much time, right? Done. One of the joints of the body in which they will ask about relations is the hip joint. So let's try and learn how to draw this diagram. So the first thing is draw the outline of the hip joint. So let's imagine this is the acetabular labrum and let's call this as the hip joint. Before you label the relations, write the key. So we will write superior, this is inferior, this is anterior, and this is posterior, right? What is the easiest relation to draw? It is always the posterior relation, right? So the posterior relation should begin with the muscles related, right? So what is the chief muscle related to the hip joint? So one muscle that we can write is the gluteus maximus, right? Since this is an important diagram, we are drawing it and showing. So write first the gluteus maximus. Now, deep to the gluteus maximus, we have gluteus medius and minimus, but these are present in a more superior plane rather than posterior plane, right? So superiorly, we can write the gluteus medius and then the gluteus minimus, right? So what is this? Gluteus medius, then we have gluteus minimus. In addition, there is one more muscle which will form the superior relation. Let's call this as the reflected head of, this is the reflected head of rectus femoris muscle. So, three important muscles which form the superior relation along with gluteus maximus. So remember, gluteus maximus will form both superior as well as posterior relation. Deep to the gluteus maximus, now let's write one important muscle and let's call this as piriformis. Right? So this is piriformis. Below the piriformis, we have the tricipital tendon. If you remember, this is the obturator internus muscle. Above and below, we have one muscle, right? So what are these muscles? This is the superior gemellus and this is the inferior gemellus, right? Further below, we have one more muscle and this is the quadratus femoris, right? So these are the muscles that are present posterior to the hip joint. Then one important nerve which emerges from the lower border of piriformis and passes under the cover of gluteus maximus. So what is this nerve? This is our sciatic nerve, right? These are the major structures you need to show in the diagram. So posterior relations over, superior relations over. Now let's talk about the anterior relations and inferior relations. Inferiorly, we have a muscle called as, so this muscle is the obturator externus muscle. What about anteriorly? Anteriorly, from above downwards, this is the straight head of rectus femoris, right? Then we have a big muscle here, right? Let's call this muscle as the iliopsoas, right? The iliacus muscle and psoas muscle, which is forming a common tendon. Then further below, we have one more muscle and let's call this as pectineus, right? Apart from this, what are the other structures we need to write? We need to write the vein, artery, and nerve, all of which is present within the femoral sheath, right? So what are these structures? We have the femoral vein, we have the femoral artery, and lastly, we have the femoral nerve. One thing we missed out here is the femoral sheath is present only around this structures, right? It is never present around the femoral nerve. So that is what we need to correct, right? So this is how we depict the relations of the hip joint. As I said, if you can write this key, your job is pretty simple. This is how you should write the diagram for relations of the hip joint. Done? Right. Once we have learnt about relation, the maximum marks will be allotted for movements and muscles responsible for them. Now, if you ask me how to write it, I would always suggest make a tabular column, name of the movements, and muscles bringing about it. If you are very confident, I'm repeating again, if you are very confident, then only write two columns mentioning it as chief muscles and accessory muscles. Or otherwise, what I would suggest is you need not worry at all about this muscle group. When you study even for your exams, I would suggest don't worry about the accessory muscles. Please always focus on the chief muscles, right? So two columns, movement and then the muscles. So let's try and write down what are the muscles which are responsible for the movements occurring at the hip joint, right? Flexion is mainly the function of the iliacus, then the psoas major muscle, and then we have the rectus femoris. This you must never forget. The muscle which cross front of the hip joint will bring about flexion of the hip joint. Right? Done. Then what about extension? This you cannot miss. Right? How do you stand up from sitting posture? This is the extension of the hip joint. And what muscle brings about it? This is brought about by the gluteus maximus. Right? Apart from gluteus maximus, hamstring muscles will bring about extension of the hip joint. But the primary extensor again is gluteus maximus and then list all the hamstrings. For example, first semimembranosus, right? So we have semimembranosus, then we have the semitendinosus, and we have the long head of biceps, to be exact biceps femoris, and ischial head of, right, ischial head of adductor magnus. Just for the sake of completion, I'm writing it as AD, but never use abbreviations in your exam. Write it completely as adductor magnus. So one chief extensor and four hamstring muscles. Right? Done. What about abduction? Right? Remember, abduction is one action for which the examiner will directly look whether you have written it correctly or not. So you must never miss this. So remember here, the muscles include gluteus medius, then gluteus minimus, right? And the tensor fascia lata, right? So we have tensor fascia lata. These are the three muscles that bring about abduction. As I said, every examiner will look for iliacus and psoas as flexors, gluteus maximus as the chief extensor, gluteus medius and minimus as the chief abductors. Right? Then, how about adduction? Remember, in adduction, we need to remember adductor longus, adductor brevis, right? And last one is adductor magnus. But here, write it as the adductor part, right? Hamstring part brings about, ischial part brings about extension, adductor part brings about adduction. Then, what about the medial rotation and lateral rotation? Fine. The lateral rotation, remember, is the function of the piriformis muscle. One, we'll come back to medial rotation. Lateral rotation is done by piriformis. Then it is done by obturator internus muscle. Then superior and inferior gemini. Right? Then the fourth important muscle is the quadratus femoris. Right? These are the main muscles that will bring about the lateral rotation. Right? Now, in medial rotation, we can actually mention about the pectineus and the adductors, right? These will bring about medial rotation of the hip joint. Done? Remember, this is the section which will carry maximum marks usually. 4 usually kept for muscles and the movements brought about by these muscles. Done? Lastly, regarding applied anatomy, what we should write here, the congenital dislocation of the hip, right? So the first thing you write is congenital dislocation of the hip. Whenever the question is about the joint, the first thing we should always write is dislocation. Hip joint is a very peculiar joint where two types of dislocation occurs. One is congenital and the other one is called as acquired. Congenital dislocation, what is one point you must write? This is more common in girls. One question which can come as anatomical basis. Why the dislocation of the hip is more common in the females? This is because of a vertical lateral wall of the pelvis and the shallow acetabular cavity. This could be a Viva question. This could be a 3-marker question, anatomical basis type of question, right? Done? Then acquired dislocation is usually not common because hip joint is a stable joint. Compared to shoulder joint, your hip joint is very stable. Chances of dislocation is comparatively less, right? Acquired dislocation can be of 3 types, right? One is anterior, other one is posterior, and then we have the central dislocation, right? Most of these dislocations are found with road traffic accidents, but just mention the types of dislocation. Next, we have 2 important abnormalities which are related to the neck shaft angle. If the neck shaft angle is decreased, we call it as coxa vara. If it is increased, we call it as coxa valga, right? Lastly, mention about osteoarthritis. Osteoarthritis of hip is very common in old age. For any joint, the hip joint and knee joint, apart from dislocation, one common answer you can write as osteoarthritis. Are we clear? Right? Now, this is how you should explain the hip joint, right? If you wonder where you lose marks in long essays, this is where you will lose marks. If you don't mention the names of the muscles with the movement, if you don't add few lines of applied anatomy, especially with respect to ligaments, if you don't mention at least couple of lines about ligaments. So never ever forget to mention about the ligaments, right? So what you can do is you can actually use this as a quick revision for your exam, a handout that will come in very useful or very handy during your exams. Fine. So this is how we should write or represent a long essay on hip joint, right? If there are any doubts pertaining to this, please let me know before we close the session. Right. Since we have no questions or no doubts, I thank each one of you for joining again. Revise the session and use this handout as a ready reckoner or a notes. It will come in very handy for your exams. All the best.